Good afternoon and thanks for joining us for Living Local, your lifestyle show for everything Charleston. I'm Ashley Meservey. It's Medical Monday here at East Cooper Medical Center, and today we're talking about summer activities, specifically youth sports, and what parents need to know in order to stay safe on and off the field.
Medical Monday, sponsored by East Cooper Medical Center.
Joining me now, Dr. David Geier. Thanks for having me here.
Oh, thanks for having me.
Okay, well, let's talk about, we're talking about kids in sports, summer's coming up, activity, lots going on. So what can parents, first off, start as far as being safe during the summer?
Well, obviously you have to deal with the heat. So I think you've got to get kids ready for the heat. Right now, you just can't send them out 90-degree temperatures, 80-degree humidity, maybe start indoors and work into the heat slowly.
Okay, and as far as we talk about concussions and all of that kind of stuff, it's been a big thing in the news. How do you really know when it's an issue and when it's not?
You really have to get the kids to talk and tell you that something's wrong. You're not obviously going to see every little change, so they need to tell you they have headaches or other symptoms and then get it checked out. Okay,
well, obviously we're here at East Cooper and this is a great facility. What are some of the things that you do here?
Well, we're in physical therapy. This is where after an injury or after a surgery, people get back to what they love to do. Get their motion of their shoulder or knee back, get their strength back, and get back to the movements and the techniques and the skills that they need to play sports or exercise.
So do kids come in here as well?
Yeah, absolutely. You typically find them after school late in the day, but they'll be here bouncing off the ladders and doing their strength training for sure.
Okay, let's say we're at a summer camp and we get an injury. How do we know we need to seek professional help or that we need to come see a doctor?
It's tricky. I think it's always a good idea to maybe take a day or two off, see how you respond. Anti-inflammatories, ice. If you're not getting better, if you can't do what you want to do as well as you want to do it, then it's probably worth getting checked out.
Where do you see the most injuries when it comes to children?
Typically there's traumatic injuries in sport like football, soccer, where there's collisions, but what we typically see with kids are overuse injuries. They keep doing some motion over and over, days and weeks and months, that just doesn't get better, then it turns into a bigger injury.
So how would you say you can and you have children, differentiate between a kid just not wanting to go to practice or actually having a legitimate issue like maybe shin splints or something?
Absolutely. It's tricky because you've got to get open communication with the kids so that they will tell you that something's wrong. Because if you're pushing them, hey, it's about winning and statistics, you're right, they're not going to tell you, and they're going to just use excuses to not practice. So you look for subtle changes and then open the communication, let them tell you they're hurting.
Summer months, so hot, dehydration, we were just talking about that. What are some of the signs of that?
I think it's getting easily fatigued. At first you start sweating a lot, then you actually start decreasing your sweating, and you're just not able to train at the same level. So again, it's all about starting slowly and getting your body used to it.
Cramping, I'm sure, happens a lot
absolutely.
as well. So as far as getting ready for the fall, that's also when sports start ramping up. I know you said that they need to start slow, but what kind of advice would you give to them as far as how to go about that?
Absolutely. The key is to not wait until the fall to get in shape. We see that with these high school kids all the time. They show up at the beginning of August, overweight and out of shape. Start training now. Use this time to get in the weight room and start running, starting to get exposed to the sun, so that when you get to August, your body is ready for the intense training. If you're out of shape, all sorts of bad things happen.
I just have this as a question I just thought of. As far as kids and when they should be in the weight room, do you have like an age that you think that's appropriate to start lifting weights?
I actually have no problem with kids lifting weights. I think they need proper technique, and so the adults supervising them, teaching them the right ways to do it, and then the right goals. Their goal is not to lift hundreds and hundreds of pounds.
A refrigerator.
Right. Lower weights and higher reps, but doing proper techniques. It can have a lot of beneficial gains, but it's got to be done correctly.
And obviously making sure you have the right person, the coach, or whoever's facilitating that as well.
Absolutely.
Well, thank you so much for your time. And of course, for more information, you can go online to their website at eastcoopersportsmedicine.com.